Hi there, Holly. I'm a special procedures tech and I'm here to show you how to make a sterile table. Over here you can see that I have it semi-open, but I have to put my mask on. You have to make sure your hair is closed up to make sure that you don't drop any hair follicles or anything. We want to make sure that we don't cause any infection. So here goes. You want to make sure that you grab your ends without touching too much of the field, and the same on the other end. Do not contaminate anything in here. So next, I'm going to put a gown on and some gloves in order to actually create my table. You don't want to touch anything with your own bare hands because that would defeat the point. So first off, hand hygiene. Make sure that they're nice and clean. We use the solution here that doesn't require water. We just have to make sure it's nice and dry. For putting on the gown, you make sure you just grab the middle because this is the part that's going to touch your body. Your hands go in the flaps here, and you kind of just let it drop and fold out and put your arms in. Dorota is going to tie me up. And you always want to have your hands still in the arm sleeves because you don't want to expose them too much. And you kind of pinch the end of the gloves. I always do my non-dominant hand first, because I can use my dominant hand to help put it on. And now that this is sterile, you can grab the glove anywhere, because this glove is completely sterile, and fit your other hand in. And then you want to make sure that you pull them all the way down so that all this stays completely sterile. And then adjust anything you need to, make sure your fingers are good. So now I'm all sterile, now I can touch my table. So these packs come with an assortment of supplies that most cases always use. So we have a cover for the table at the end. We have a cleaning solution. It's an alcohol-based prep. Things to put any kind of fluids that you get from patients. You want to squirt it in here so that it doesn't get all over and we contaminate an entire room. So we got bowls for water, saline or hep saline, whatever it may be, depending on your cases. Extra towels for every patient. You want to cover the area that you once cleaned them with so that when you put this big drape on them, so this is the big drape that you would use to cover up the patient. It's got a sticky surface around it. You take this off and you lay it on them. So we'd have the towels around the sterile area that we would wash with the solution, and then you lay the big drape on them and it would fold out, and then the entire patient is also our sterile field as well. So another nice thing about our tables here is that we comes with labels, and it's very important that we label all of our syringes. So it comes with different types of syringes. We have 12 cc's and we have 20 cc syringes. 20 cc syringes are usually meant for water or saline, and then your 10 or 12 cc syringes are for medications, contrast, anything like that, like lidocaine. So our label system comes with exactly what those are. That way we can time date it and initial it. It's important that we do that so that we don't use anything that's expired, and we know that it's a fresh table. You don't want to use anything on a patient that has been sitting out because it risks of contamination, and that's our goal, again, infection control. So then it also comes with needles for picking up supplies. Always I kind of hide those in the sharps container. They're blocked right now with their lid, so it's not that big of a deal. Same with our scalpel. That one comes with its own sharp protector, and then we have some hemostats here. So your goal for your table is to make sure it's nice and organized so that when you or someone else comes in for the case, they can easily find the supplies. Because if once you're in it and things are going fast, you have wires and everything, you want to make sure that you can still get to everything nice and easy. So I like to organize mine where hemostats are right available, and then I would have my drugs labeled and what order they would be used. I would have my wires laid out. I'm not dropping off as much right now just because who knows if the patient's going to show up and then all of a sudden they don't, and then you waste all this money on dropping supplies. But for now we can just drop a few things. We'll put some water into the bowls so you can see how that's done. You want to make sure that it's about ready. We're going to just show you how to properly drop the water into the containers here. Sister Rhoda, she's going to just pour it in. You want to make sure that this tip doesn't touch anything and that the water is flowing right into there. You want to make sure it doesn't hit the edges and pour over either. And that was a nice transition into the other bowl. Didn't get anything anywhere else. That way everything stays in there, and I can start filling up my syringes if I needed to. My water is nice and sterile, but for right now, my table is just about complete. And last I would do is just cover it up with this big cover and make sure that it covers all the edges. That way when the patient comes in, then we can undress it and use it. So that's how you would make a sterile table. You just want to make sure everything's nice and organized. Everything stays nice and clean, uncontaminated. I stay nice and clean and uncontaminated, and it's ready for use. I hope this kind of give you guys an insight of what special procedures is and how a sterile field needs to stay. Thank you so much.